Rural hospitals are facing a silent crisis of staffing shortages, threatening access to care for millions. But what if a key solution wasn't finding more staff, but using remote expertise to make care even safer and faster? This isn't just a theory, it's a reality made possible by a major policy change from Medicare and Medicaid services. With a massive physician shortage projected by 2034, this kind of innovation is no longer optional. We'll now break down what virtual supervision is, how it boosts access and efficiency, and why it's a lifeline for rural healthcare. So, what is virtual contrast supervision? It allows a radiologist to oversee a procedure from afar using real-time audio and video. Traditionally, a physician had to be physically on-site for any contrast-enhanced scan. For a rural hospital, this meant delays or cancellations. The CMS policy for virtual supervision breaks this bottleneck. It ensures safety standards are met without a radiologist physically in the building. This directly tackles chronic staffing shortages in medically underserved areas. It keeps services running, preventing canceled appointments and lost revenue. And it helps radiology groups everywhere manage ever-increasing imaging volumes. But how can one radiologist manage this remotely? In a moment, you'll see how it can be even safer than having someone in the room. The foundation is real-time, high-fidelity communication. Secure video links create a virtual presence for instant consultation. This technology allows one radiologist to supervise studies across multiple sites at once, overseeing a network from a central hub. This is why the cost savings are so significant. Hospitals avoid paying expensive locum tenens fees and allocate resources more effectively. This new efficiency doesn't just save money, it expands care. Facilities can extend operating hours and schedule more patients. Essentially, virtual supervision decouples the radiologist's location from the patient's point of care, ensuring continuous access. The theory is sound, but what does the data show? Are there measurable improvements in the real world? Yes, an RBMA survey found stunning results. About 30% of imaging centers reported faster response times with virtual supervision. The impact on access is immediate. Appointments proceed without delay because a remote supervisor can always step in. Imagine a farmer in a rural town needing an urgent scan. Before, they might wait days. Now, the scan happens same day at their local hospital. For a healthcare system, this means they can standardize quality across their entire network. Every patient gets the same high level of oversight. Now, let's return to that question of safety. It seems impossible that a remote doctor could be safer, but the evidence is surprising. Here's why. A remote supervising radiologist is focused solely on that task. They aren't pulled away by other clinical duties or on-site interruptions. If there's an adverse reaction, the on-site team provides hands-on response while the remote radiologist gives expert guidance. It's a faster, two-pronged approach. This model is not a workaround. It's a fully compliant solution, built to adhere to strict guidelines from CMS, the ACR, and HIPAA. Every interaction is logged, providing detailed documentation for safety and billing. This creates a strong and auditable level of oversight. Let's pull all these threads together. You've seen the policy, the mechanism, and the real-world results. What is the big picture? The CMS policy directly addresses the projected physician shortage by creating a more scalable model of care. The real-time communication we discussed allows a faster, more focused response, turning a perceived safety risk into a strength. So, virtual supervision is not just a band-aid for staff shortages. It's a fundamental shift that makes rural healthcare more resilient and financially stable. The conclusion is clear. This policy change improves patient access, increases operational efficiency, and dramatically reduces costs for the hospitals that need it most. The current CMS policy is now permanent. The success of this model makes a powerful case for policymakers to secure the future of rural imaging. This is more than a policy or a technology. It's a lifeline. It's how medical facilities ensure that your zip code doesn't determine your access to life-saving diagnostic care. Hospital administrators should consider implementation now. Share this video to spread awareness.